Okay, so what are your treatment options for plantar heel pain? So your list of options is quite long. So for short-term effects, you're looking at the top of this list. For stretching of the plantar fascia and the gastrocnemius soleus, you can expect short-term pain relief for a period of a week to about 4 months, roughly. I clinically find a little more benefit from the plantar fascia stretching rather than the gastrocnemius soleus, but again, experiment with the person in front of you. And then you can look for rigid elastic taping to provide a little bit of support to the structures. So again, you're looking short term for rigid taping lasting for a few weeks and elastic taping lasting for less than that, for about 1 week in terms of the benefits. Again, manual therapy comes up, which you're looking towards your joint and soft tissue mobilization. Again, the effects tend to be temporary, but can still be useful. If the condition is not progressing after a period of 4 to 6 weeks, you can start to consider something like shockwave. And in a similar time frame, something else you can consider if they're not progressing after a period of weeks is your IMS. There's a debate on the length of the effects and how long they're maintained, but it can last from periods of 6 weeks to up to about a year. And then if they continue not to progress after about 12 weeks, you can look to custom or over-the-counter orthotics to support the medial longitudinal arch, and you can expect benefits for those for a couple weeks up to about a year. And this tends to be especially useful in those who respond well to the taping. And then lastly, we have night splints, which are more of a chronic option. So if the condition continues to progress, you can prescribe night splints for a period of 1 to 3 months, roughly, to see if they'll be beneficial for that person. So what are your things, or what are the things you could be considering? Strengthening of the foot and the calf complex, depending on what the person can tolerate. Heel pads, which just provide a little bit more support for the posterior aspect of the heel, which may be more sensitized. Shoe change, so rotating shoes for those who stand long periods of time. And you can consider the use of a rocker bottom shoe, plus or minus an orthotic inside, depending on what the person prefers again. Laser here is one of the maybe options, so low-level laser therapy. And then lastly, we have gait retraining, which largely focuses on decreasing vertical impact, but we'll talk about that in a later section. So the things that you shouldn't bother with would be your electrical modalities, so electrotherapy, ultrasound, and corticosteroid injections.